Extraordinary times allow extraordinary people to do extraordinary things. Jared Sharza is one of those people. When COVID struck in the United States, Jared was a third-year medical student studying at the University of Medicine and Health Sciences. He had less than 2 weeks of his rotations left in his third year when his program in Detroit was canceled due to the pandemic. His immediate thought was, I will not be sidelined. I'm so happy to have Jared here with us to share his story. Welcome to Finding the Good Life, Jared.
Hey, Dr. Gene, thank you for having me.
So tell us, what happened?
So as you said, it was towards the end of my first rotation of my third year as a student at UMHS. I was rotating in Detroit in my internal medicine program when we got an email one day, and it was saying that we had to stop our rotations and they'd be temporarily suspended for a couple weeks at least until COVID kind of subsided. So my first thought actually was I had to go home and kind of, put my skills to work as a medic, which I've been for, nearly 7 years now.
So what'd you do? What happened?
So I was driving home, actually. I left the hospital and, I was starting to think about all these things. The first thought was, I won't be sidelined. I can't be sidelined. Being a medical student, you're kind of, almost there to being the point of a doctor, but you don't have the actual credentials or anything to really do too much to help the patients. So I knew that I could go back and work as a medic and really make, an impact, on the front lines fighting COVID.
Was that a hard decision for you to make in terms of thinking about your own health and well-being?
To be quite honest, I didn't really, think about that. It was almost an immediate decision to go and help, in a medical capacity. It was something that I knew I was good at. It was something I knew I enjoyed. I knew that my EMS agency, Canandaigua Emergency Squad, was short-staffed at the time, so I felt it was almost my duty to go right away and help as much as I could without thinking of my health at the time,
So
unfortunately.
were you credentialed as an EMT or no?
Yes, so I've been an EMT basic for 2 times. I've recertified as a New York basic EMT.
So you began working in a hospital?
So actually, it was incidental that I ended up working in the hospital throughout COVID. It started off, I was working as a medic, and when we were bringing patients to the hospital, I knew a lot of the physicians there, and they knew that I was a medical student as well, and they thought it would be beneficial to my education actually as a medical student if I were also working in the hospital. And they kind of talked it up to administration to see, what I could do, where the line was with what I could do helping in a medical capacity. So I ended up working. I was recruited and worked as part of the surge team on the COVID units and in the ICU as a patient care tech, doing phlebotomy interventions, helping the nurses, and kind of just being an attendant for all the patients. And they allowed me to actually practice my medical examinations
That's
on
great.
patients as well.
I know, being from New York, I know that New York was the epicenter of the outbreak. It just went bam in New York City and then traveled all throughout the state. What was it like for you being in New York State at the height of the COVID outbreak?
Yeah, so kind of at the time when I was displaced from my clinical rotations, New York City was, the epicenter. But upstate New York hadn't really been as affected yet, but it was, an impending event and situation that everybody kind of knew was eventually going to happen. So with EMS, it kind of came up and it was affecting a lot of the nursing homes, kind of, one right after the other. And it was overwhelming for quite a lot of people in a lot of different cases. So we would go to nursing homes a lot of the times, and it would be, one patient after the other. And we'd be there for, one patient, and the staff that would be at the centers would say, hey, we have another one for you.
Oh,
Could you
wow.
bring them too? No, we can't. We need to, call another unit. And so it was a lot of going back and forth and decontaminating the
Wow.
ambulances and gowning up in our PPE before we'd go into the nursing homes and health centers themselves. So it was a unique experience that I'd never experienced
It
before.
must have been trying, not only trying physically, but emotionally and mentally to see what was going on and to be there. I'm sure you had long hours and saw some tough things.
Yeah, there was a lot of experiences, that were negative, and there's a lot of things that, I definitely remember. And it definitely did mentally affect a lot of different medics. It mentally affected nurses, everyone really in the healthcare front line that were seeing these patients. There's a lot that we kind of remember, but at the same time, there was a lot of commiserating and a lot of positive things that came out of it. And one of the positive experiences from all this, all working in the ICU, at least, we would have morning yoga sessions, kind of to get everybody,
Wow.
mentally leveled
Ready.
and prepared for the uncertainty that was to come.
But I'm sure you don't consider yourself a hero, but I think I see banners and signs and everything everywhere I travel and everywhere I go, attesting to the dedication of frontline workers like yourselves. And your actions and dedications have really helped many, many people. It's amazing. I hope that other medical students who find themselves in the same situation and individuals find a way to serve and to give back. I really want to thank you for your service, and thank you so much for joining me on the show today. Appreciate it.
Thank you, Dr. Jean. Thank you for having me as well.
Well, we have to take a short break, but there's much more Finding the Good Life to come, so stay with us.